All this is Dr. Mobeen Sayed from drbeen.com. Today we have a cool bean with us. He and his girlfriend has been through COVID-19. Thank God, thank the lucky stars, whoever you believe in, they are both fine and they are here. And this is very great of them. This is very kind of them to be able to come in and share their experience
Mhm.
and talk us through the experience they had, number one, and number two, the therapy they had. I was especially intrigued by the ozone therapy that
Mhm.
Patrick's girlfriend had. So we have with us Patrick with us. Patrick, welcome and tell us a little bit about yourself.
Well, thank you for being here. I'm very humbled to support the all the cool beans that are out there, and I just love this site. Myself, I'm a production manager at a paper mill. I'm 67 years old. I have a body mass index of 24. I pole vault for fun. I've got a master's in biochemical engineering, a master's in stats, a master's in business, and four undergraduate degrees, and four majors and three minors. And I have always been uh, oriented towards health ever since I was playing ice hockey back in the 50s, 60s, and 70s. The story begins. My girlfriend is a PhD clinical psychologist. She works in the school system in Upper Michigan. That's where I'm from. Upper Michigan is a chunk of the state of Michigan, which is next to Lake Superior. It's 400 miles long and 40 miles wide, and there's about 350,000 people up there. And we kind of joke that's counting the cemetery. We have social distancing. We take that to a whole new definition, about 20 people per square mile. This past spring, obviously, COVID broke out in North America. Upper Michigan never seemed to have been hit. So in May, we both had our antibody tests done. They turned out to be negative. No IgG, no IgM. We were fine. So we didn't know what to make of that. Neither did our attending holistic MD in Marquette. So we went through the summer and we sailed into the fall. And I suggested to my girlfriend, I think you need to increase what I call the COVID cocktail. Now, a little background on that. I have been taking an antiviral concoction for about 5 years, which is one gram of quercetin, 6 grams of C, 50 milligrams of zinc, 3 milligrams of copper, and 100 micrograms of selenium, and 20,000 IUs of vitamin D. Now, I know that sounds a little high, but what I found in my working with world-class athletes, you burn up D as fast as you burn glucose. So at that level, that kept my vitamin D right around 60 nanograms per milliliter. Now I know that because every year, about in October, I get an annual blood draw of close to 41 tubes out of my arm. Not kidding. I am an engineer, so I love to test. So now that COVID came out, I increased my D to roughly 30,000 IUs a day because I knew that would bump me up to right around 100. Would I need it? I don't know, but I don't want to risk it. So one thing leads to another, and my girlfriend, who was also taking not quite the levels I was in the COVID cocktail, in fact, and she was somewhat intermittent in what she was doing. She has a body mass index of 29. She's 62 years old. And she came down with bronchitis the first week of October. Well, it was the classic up in the upper respiratory, the gurgling and all that business. And it's like, well, okay, get that fixed. But she didn't want to get any medicines. She thought she could beat this naturally. I said, boy, you're going to drive down your immune system and COVID's everywhere. Well, she eventually got up with Teladoc, got some antibiotics, fixed that, but within a day of it getting fixed, she had the COVID cough, that stuff, almost instantaneous lethargy. She described it as being somewhat hungover. She just had no energy. So one thing leads to another, and finally, on November 3rd, she went in for a rapid PCR test, and it turned out to be positive for COVID. So I went in the next day and they checked me on the 5-day normal PCR test, and it turned out positive for COVID. Now, we have a holistic MD that we work with in Marquette, Michigan, and I immediately contacted him to get an IV drip of 20 grams of vitamin C and, which is really cool, the plasma ozone treatment, or red blood cell ozone treatment. So I brought my girlfriend, Roxana, up to Marquette on Thursday. That would be, I believe, the 6th of November. She received both treatments. Now, the blood is pulled out of her arm, about a pint, and then it's ozonated and put back into her body. Right after that, they put in the 20 grams of vitamin C. It took about 45 minutes to an hour for that to drip in. We also had our antibody test, just to see what we were doing. Well, my antibodies showed up as a strong IgG and a weak IgM, which indicated I had been exposed and I was on the healing side of good. Her IgG was faint and her IgM was very strong, which indicated her body was still in a tussle. Well, she did all that. I brought her back home, and we repeated the same process on Monday. But what was interesting, Saturday morning, she said, I'm a new person. On Monday, I took her back up there. We did the same thing again. We had the same antibody test again. Her IgG became stronger. Her IgM became weaker. My IgM was weakening all along. And brought her back. The next morning, she woke up like she was never sick in the first place. In fact, she was feeling so good, she says, I don't want to go for a third time. I says, no, you're going. We've got to kill that little bugger. So we go up there a third time, do the same thing. The antibody test turned out her IgG was strong. Her IgM was much, much weaker than what it was. My IgM, you could hardly see it on the test, which indicated we were making progress. About that time, the holistic MD and I had a good long chat about what's going on here. And he basically...
So, Patrick?
What's that?
Patrick, if you can give me just one quick second, my apologies for interjecting. For your antibodies, I want to answer this question from Pasi, and I hope that can interweave. So if you are okay, can I just very quickly answer this one question?
Don't worry.
Thank you. My apologies again. So, Pasi, what happens is for SARS-CoV-2, it is known that IgM and IgG start developing at the same time. However, what Patrick is talking about is that one of them is more in titer, more in amount versus the other one. So they both were detected, but their titers were different, their amounts were different.
Yeah.
So back to you.
Right. So if you look at the various curves that come out for IgM and IgG, you've got the 14-day window, and then the IgM starts to take off, and then halfway through, then the IgG starts to take off. And that's basically what happened with her. And what the holistic MD said about that COVID cocktail that her and I were both taking. Oh, by the way, when she started with this IV drip and ozone, she doubled up on all of her vitamins. He said, you're not going to keep from catching the virus. You're just not. But you're going to defang and declaw the virus, so it'll just be a mild vitamin or mild viral exposure. So henceforth, it'll give your body a chance to develop the antibodies in a rational amount of time so that you don't really get sick. And that's what I believe happened. And
so I think you kind of answered this question as well from Jenny. She's saying that I want to know, what did the natural doctor say? So I think this is what you just mentioned. His approach to the treatment was that while the body is learning to fight the virus, let us provide whatever help we can.
Mm-hmm. Exactly.
So tell me this, and this is my own curiosity as well. Why ozone? Why didn't you think of something else? Who came up with that idea? How did you arrive at that, and then how did you say, yes, we want to do it?
Well, I have a lot of friends in the holistic medicine world throughout the planet. And I had learned years ago that ozone really makes a difference in certain applications. And when I saw how sick Roxana, my girlfriend, was, I went, she needs that, because the symptoms fit the solution. I'm an engineer, it used the right wrench on the right nut or bolt. And I knew vitamin C in high doses is the right wrench for the right nut to get the job done. So I immediately called him up and he said, yeah, let's do it. So I just happened to know about it over years of working with holistic MDs.
Very good. And so tell me this, you did not go through the ozone therapy, correct?
No, sir.
Your girlfriend did. So how did you decide that you are okay and she needs to do it? What was that thinking? What was that decision-making process?
Well, the decision-making process was fairly straightforward. I was absolutely asymptomatic. I was at the paper mill while I was working. I was still walking 3 to 7 miles a day, out walking people 1/3 my age. There was no problem. No coughing, no symptoms whatsoever, no temperature. And what was funny was during all of this time on October 26th, I went in for my annual blood draw. I felt fine. So they checked my forehead temperature and all that. I'm fine. And then, and this is really interesting, on Monday of last week, I got my blood work back. And if you would have given that blood work to any run-of-the-mill physician, they'd say, you're fine. My high sensitivity C-reactive protein is normally between 0 and 0.3. I think that's picograms per milliliter or something like that. This time it was 5.5. And I looked at that and went, my, we have a problem here. And my interleukin 6 was 15.6, and it's normally 1.4 to 1.5. And I have about these tests go back 15 years, so I have a pretty good handle on how my body is. But all my white blood cell stuff was absolutely perfect. And if you didn't have those two tests, you'd say, there's nothing wrong with you. So I followed that up with another PCR test on this past Saturday. And then Monday, Roxana and I went in for another exhaustive panel for all of the various interleukins and C-reactive proteins and Ds and everything else, so we can have a baseline now that we're healthy. What does a healthy baseline look like coming out of COVID? And looking at the literature, like C-reactive protein, you can get that when the cytokine storm up to the 80s, if not 100s. And interleukin 6 can go up to 150. But still in all, for myself, it was like, wow, that's an eye-opener. And I still had no symptoms. So
interesting. So for the listeners, for the cool beans here, I want to at least mention one thing, and I think that is important. If you are listening to the cocktail, as Patrick said, please make sure that you look at your body, you look at your own situation, talk with your doctor.
Mm-hmm.
Do not take them as a prescription for yourself.
Right.
I know that we all tend to do that. Wherever we hear a good news, we try to adapt it so that we are protected as well. But some of these things can actually be negative.
Right.
If not taken at the right time, or not taken at the right quantity, or not taken with the right material. So
right.
please make sure that you talk with your doctors as well. And then you go through these things. I want to ask Patrick, if you don't mind, you had in the beginning described what you have been taking. I would request you once again, for the cool beans here, what is your cocktail that you have been taking? And you mentioned it before, I know. So I'm requesting you to repeat. My apologies for that.
Happy to.
But there are some more audience, I think that they would benefit from it. And once again, guys, please talk with your doctor before you take it. Patrick, what have you been taking?
Okay. I agree with you, doctor. Test, and everybody's body is different. Test. I'm an engineer. I just like to test stuff. Okay. Vitamin D, 30,000 IUs a day. Okay. I was at 20,000 before COVID. I'm at 30,000 now. Couple of reasons. I work out a lot. And number two, living in Upper Michigan, we don't have any sun. It's one of the darkest places on the planet. And the joke is when the street lights come on, we bring out our blankets and put the suntan lotion on. We just don't know what the sun looks like. So we're perpetually vitamin D deficient. So I know vitamin D helps, so I took my vitamin D. I took 100 micrograms of selenium. I have been doing that for at least 10 years because I live in a selenium deficient area. And 100 micrograms of selenium is a safe amount, but yet I still test for it every year to make sure I don't do anything dumb. Or it's like I tell folks, eat one Brazil nut. That'll work too. The next thing I do is I take my quercetin. I've been doing that for 5 years. I take 1 gram of quercetin a day, along with 50 milligrams of zinc and 3 milligrams of copper. If you're taking zinc, you got to take copper in a 15-to-1 ratio, roughly, or you can get sick. To your point, Doc, dial your body in, be careful, work with your physician, and just dial the whole thing in. So that's basically what I've been doing, in addition to having 6 grams of vitamin C in divided doses throughout the day. And that's what I do with that, because typically your body can tolerate about 2 to 4 grams at a crack, and then you can have intestinal issues. And I've learned over 18 years of doing this, that works for me. Sometimes, if I have an allergy, I might increase it to maybe 10 or 12 grams a day, but not much. I very rarely do that. But that's for my body and nobody else's. So that's it.
Got it. So tell me this thing. So you mostly went asymptomatic, which congratulations for having a good health and having a good immune system. Again, it seems like some of us have an immune system that, despite all of these things, tends to go awry in this situation and becomes worse for us. So I do not know what is the right answer. Is it vitamin D, or is it quercetin or zinc, or what? But it seems that some of us, when they take these cocktails, their body responds better.
Mm-hmm.
Tell me this, your girlfriend, what symptoms did she experience?
Well, she initially started off with bronchitis, and then when that was fixed within a day, she came down with a COVID cough and unbelievable lethargy, a temperature, slight headache, and finally by this, she fought that for about 2 weeks, and she just didn't want to do anything. She was stubborn. I'll just be very blunt. She was stubborn. She didn't want to double up on her cocktail. She didn't want to do anything. So finally, when she could barely get out of her car, she finally surrendered, and we finally started things going in the right direction. Now, in terms of blood work history with her, she doesn't have the same level of enthusiasm that I have for testing myself. So she doesn't do as much, but that's okay. I think that has changed as of this past Monday, which is great. Yeah, everybody learns. Everybody learns.
And to Courtney Powers' comment, it looks like Dr. Syed needs some vitamin C. It sounds like he has a cold. Courtney, so here is the interesting thing. Whenever I take vitamin C, I start coughing. It irritates my throat. So I usually, when I take it, whenever I take the supplements, after that, you may have noticed me sometimes coughing as well. So I have some problem with vitamin C, but I would take more. So what I have been doing nowadays is taking and eating oranges, but I would take more vitamin C.
My son, Eric, he takes vitamin C 10 grams a day, and he mixes it up with some water, about 2 to 4 grams at a crack, and just sucks it down. He has the powdered form. Works real well.
Yeah, so I think I'm going to try the powdered form as well. So how about, Patrick, so thank you very much.
Mm-hmm.
Thank you for coming on. Thank you for sharing your experience, especially the ozone therapy, because we have been talking about this, that, hey, we should talk about ozone therapy. And here you are with this. Would you be okay if we take some questions from the audience as well, from the Cool Bean?
Sure. Not a problem.
All right. So first of all, there is a question from Earth Angel. How is vitamin C infusion effect different from pill? Is this something that you want to take this question?
Sure.
Yeah.
When you take vitamin C, by a pill form, about the most your body can absorb at one crack is about 4 grams. Then you have to wait about 2 to 4 hours to take another 4 grams if you're taking 4 grams. So that would be, if you're going to take 20 grams, that's a lot of screwing around. The 20 grams is done in 45 minutes without bowel distress, and you don't want bowel distress. That's for darn sure.
Got it. So there's a comment from Loretta Dillon-Ham. She has been a cool bean for a long time. She says, "Hey, hello, Patrick. You're looking good. Long time no see or hear. Last time was with Ivor."
Yeah. I did a little talk with Ivor on some other stuff about health. Nothing fancy.
It's a small world, huh?
No, way too small.
Tell me this, while we are going to look at some more questions on the Cool Bean, tell me, Dr. Bean's channel, has this helped in any way? How has this been valuable or not for you and your girlfriend?
Well, Jim Maddox, who's a cool bean, turned me on to your site. I found it. I immediately, almost virtually immediately, signed up for a perpetual membership. The artwork, I learned by watching and I learned by doing, and your artwork just absolutely hit home. My girlfriend, who does not have a biochemistry background or a microbiology background, she will sit absolutely in rapture watching your sketches and watching how you describe things. And she said, "My God, I have learned more from him." Oh my, I mean, I wish she was here. She would be just so effusive. And I fully agree. I learned from you. I love how you talked about the B cells and the T cells and in this arm and that arm. And I'm going far out. It's because I was a pre-med and I had the microbiology and I had the cell physiology and the embryology and all that stuff. And I'm going, wow, it's all coming back. It's fantastic. And I'm going, whoa, this is way too cool, you know?
Excellent. That is great to know. And just for the audience here, I was talking with Patrick earlier today. When I started teaching for COVID, before that, my teaching used to be a little more technical, plus less of the arty work and more of the illustrations to bring the point home.
Mm-hmm.
But there was a passion, there was a belief that at this time, regardless of what is your background, we all have to understand what is happening in our body and what things can help us so that we can protect ourselves and the people around us. So I became an artist for the cool beans. As good or bad as artist I am, but it is for you all.
Yeah, it's great. The athletes that I work with outside of my job, I also work with high school, college, and Olympic athletes. And I've told them about your site. And they will go there and they go, "Man, this makes science easy." I says, "No kidding. This is great."
Absolutely great. I love it. And this is, I think, one of the thing that gives me peace is to be able to convey these concepts and bring along the cool beans so we can all, I am trying to protect myself as well and the people around me and the patients and all of us. I have one more question here from Bambi. So Bambi's Secret says, the vitamin D dose seems very high. When I was severely deficient 7 years ago, I was put on 20,000 IU twice a week for 2 weeks, then every 3 weeks until normal, renal and calcium blood tests monthly.
Mm-hmm. Okay.
So comment.
Well, I'm a bigger person than her, I would assume. I'm 90 kilograms. I'm a big guy. And I would imagine she's tiny. And you again, D is dose dependent. If you're a small person, you don't need as much. I'll give you an excellent example. Dear old Aunt Phyllis, 91 years old and assisted living. She does the COVID cocktail. She takes 5,000 IUs of D so that she keeps her D levels between 70 and 80 nanograms per milliliter. Phyllis wanted to duplicate what I did. And I said, "Phyllis, you don't need it." Well, Phyllis being Phyllis, she said, "Oh, I'm going to do what I want to do." Well, okay. So she was taking 20,000. She ended up like almost 200 nanograms per milliliter. And I said, "Phyllis, don't do that." "Oh, Okay. Now, she's 5'5", 118 pounds, 91 years old, sharp as a tack, absolutely sharp as a tack, living in assisted living. And she has spread the word to all of her friends in assisted living. At minimum, take your D.
Makes sense. I just want to quickly respond to Asad over here. Asad, I've been looking at your question. They are not relevant to this particular discussion today. You're talking about male sterility or others. We would do separate topic, or we'll talk about those on this Friday's one. I wanted to make sure that we hear Patrick's experience, his girlfriend's experience. What had they been doing to keep themselves healthy and protected? And what is the ozone therapy experience, because we have not talked about that before.
Right.
So I'm not ignoring you or your queries. I just want to keep the discussion to the point for Patrick's presence.
Mhm.
Cool. So this is where we are. Let me see if there is any other comment here or question here. So tell me this, what scares me about the ozone therapy is drawing the blood, then treating it, and then putting it back. So in that process, there are chances of getting, the infection or mishandling the blood. How was the doctor's process around that?
Okay, very simple. You put in the needle in the arm, drain down to the floor, approximately 3-4 feet, fill up the bag with blood, hang the blood up top, and then you have your ozonator, which pumps the ozone gas into the bag. You can watch the blood go from a regular blood color to bright red. I mean, really bright red. And then when that's done, after so many minutes, you take the line off. You're already hooked up in the arm. You just let her go. It's pretty straightforward.
Very interesting.
I love it. I just, that's really cool.
Perfect. So Mball has a comment. I've heard that selenium in the Brazil nuts can be low depending on the soil of where they are grown.
I would imagine that. But again, to your point too, Doc, your body's different. Test, and just see where that takes you. One of the good rules of thumb for selenium is to ask your local veterinarian, do they add selenium to horse and cattle feed to compensate for the lack of selenium in the drinking water? And that's an indication that you might need some too. But sneak up on it. You don't want a lot of it. Got to be careful.
Got it. A few more questions, and I'm very grateful for your time. Cool Beans are very grateful for your time as well, and you are a Cool Bean as well, contributing. So question here from Reep Vara. Are there any studies using ozone therapy for COVID or other viruses? I have seen some studies. I've been intending to discuss them, but I have not yet. So there are some studies.
I believe there's something been published from Dr. Brownstein in Michigan. I believe so. And I think that's published out there somewhere.
Got it. And Patrick, one more question from Joe B. Ozone, what is the mechanism of action? What did your doctor tell you what would happen with this therapy?
Well, ozone is a very powerful chemical. And when you take ozone and you ozonate red blood cells, the COVID virus tends to hang around platelets and tends to hang on red blood cells. It's in the serum. And the ozone basically attacks all that stuff and kills it. And as we talked about earlier in the day, you've got to give your body a fighting chance to make up for lost time in terms of creating antibodies. And it just basically gives you a fighting chance.
Got it. Perfect. And one more question, Anthony. And Anthony, I'm sorry that you are a long hauler. We should talk separately as well. Have you reached out to Dr. Yo? He and Dr. Bruce Patterson has something for long haulers to test them. So if not, please connect with me over the Twitter or connect with him. So Patrick's question is, Anthony's question is, Patrick, do you think ozone can help COVID long haulers? It is unknown whether cause is viral persistence or immune dysfunction.
The long hauler question is a challenge for all of us. And Roxana was very concerned that she would end up a long hauler. And I said, look, let's first get fixed first and see where that takes you. So she went to work today for the first time, and she was a little tired by the end of the day, but she was happy she made it through. The long hauler thing is, I think it's kind of a spectrum. I'll give you an example. My brother's father-in-law and mother-in-law were in an assisted living in the Detroit area. They ended up with some COVID patients put into their assisted living area. Not good. Well, they both came down with COVID. He died, unfortunately. She survived, but her lungs are basically they're just plain scarred up, much like tuberculosis. If you look at those lung pictures, it almost looks like TB. So that means it's going to take a while for her lungs to get fixed. Now, with all the other damage that can happen with COVID, say, screwing up the carboxylation of the protein S that's on the epithelial layer, and then the protein S starts throwing microclots, and the microclots get clogged here and there. It's going to take a while for your body to fix itself. And then the body's going to be going, hey, I got to fix this. I got to fix this. So naturally, it's not going to be a happy time. I hate to put it that way, but it's not going to be. It's just going to take time to work through it. To a long hauler, I did this with Roxana to help her out one day. I gave her 400 milligrams of ubiquinol, and she perked right up within a couple hours. Might want to give that a crack to see what's going on.
Got it. So one last question, Wayne T. His question is, does Patrick take zinc as well as quercetin or hydroxychloroquine?
Yes, I take 50 milligrams of zinc with my quercetin, along with 3 milligrams of copper.
Got it.
Mm-hmm.
So, Patrick, thank you very much for your time. Thank you for sharing your knowledge and your experience with all of us. And thank you for answering the questions. I wish and pray that you stay safe, you stay healthy, and stay a good example for all of us to follow as well. Okay. Any comments before we break?
Yes, when I receive my blood work from the stuff that Roxana and I got done on Monday, I will send it to you in an email. You can post it for the cool beans out there so they can get a handle on what's going on.
Got it. So one last question before we break then. Sorry, Debbie Boss said, what ozone therapy? Thanks goodness been waiting. Ozone saved my life at start of this disease and saved me from emergency 911 ambulance call. So good for you, Debbie. And I hope that everybody stays safe and protected.
We want to defang it and declaw it. That's what we want to do.
Perfect. Patrick, once again, thank you very much from me and from all the cool beans.
Yep. Happy to be of service to all of you. Take care now. Yep. Bye-bye.